Welcome back to WIS News Prime Time. Almost any medical professional will tell you oral hygiene is important, but it may be more critical to long-term health than you may realize.
Tonight we sit down with Dr. Suvik Sen from Prisma Health to hear about a new study that links regular flossing to lowering stroke risks. Thank you so much for joining us. We appreciate it.
Thank you.
You know, it's not necessarily the first thing that you think of when it comes to flossing your teeth. You know, you often think of just making sure that, you know, you're able to get anything that's left in between your teeth out, but it really does have some long-term benefits, and it's very important when it comes to stroke health.
Yeah, so I'm a stroke neurologist.
Yeah.
Okay, and stroke is the 5th leading cause of death and the leading cause for adult disability. And South Carolina happens to be in the buckle of the stroke belt, one of the highest stroke rates in the country. So I think prevention is very important. And we know a lot of things work for prevention: blood pressure, diabetes, smoking, heart conditions. But in this study, we found that in addition to that, if one flossed regularly, that would reduce the risk of ischemic stroke or lack of blood supply kind of stroke.
So why is that? Why does flossing help reduce those risks?
Absolutely. So flossing actually reduces the risk of gum disease and dental caries. Both are oral conditions which we think leads to bad teeth and bad breath, like you mentioned. But this study found that if you flossed regularly, not only reduces the risk of gum disease and oral infections, it also reduces the risk of inflammation. So the lower level of inflammation leads to lower risk of stroke as well as heart disease. So that's the link.
Wow, yeah, very interesting, truly fascinating. And when it comes to flossing, it's a very simple habit that you could easily build. I mean, it really takes no more than a couple of minutes, if that.
That's true. And the study finds that not only if you floss at least once a week, but more frequent flossing leads to more reduction of stroke and heart conditions. So definitely, and flossing is very affordable and a simple step without much of risks associated with it.
So I'm curious, because you are a neurologist, like we've said, and where did this idea even come from to think about, oh, let's study flossing to see how that correlates?
I think for some time we've known that oral infection is tied to stroke and heart disease.
Okay.
So I went in and looked into a large study called the ARIC study, which was a national study. And we looked at, and way back in the 1990s, data was collected. Is somebody flossing? Or if they're flossing, how frequently they're flossing? And additional data, like did someone go to the dentist or do the brush regularly? And we found that the flossing effect was independent of if somebody brushed regularly or even went to the dentist regularly. So definitely it adds on to that benefit.
Wow. All right. Well, certainly different things to look out for when it comes to taking care of our teeth. Never knew it had such far-reaching implications, but we certainly appreciate it, Doctor. Let's take a look at some of the information here that we could pass along to you in regard to regular flossing leading to lower risk of stroke. You can find all that information right there on that graphic about what a healthy gum looks like and what perhaps is not so healthy. Something definitely to consider.
It is. It's a thought-provoking, study. I had no idea about this, so thank you for educating me as well as maybe some of our viewers out there. Definitely need a floss. Sometimes I really am consistent and then I fall off as well, so I'll be taking this note to heart. Thank you so much again, Doctor, for sharing it with us.
Thank you.
You bet. All right, let's get over to meteorologist Von Gaskin, taking a look at that forecast. Hey, Von.
Absolutely.